Documentation, Forms, and Certification Key Forms. MCSA-5875, Medical Examination Report, MER. MCSA-5876, Medical Examiner's Certificate, MEC. MCSA-5870, Insulin-Treated Diabetes Assessment. MCSA-5871, Vision Evaluation Form. Expiration: maximum 2 years, unless condition requires shorter interval. Determination pending, only for missing information that could qualify. Not used when driver fails standards. Incomplete exams, when driver leaves before completion or refuses to continue. Verification: must confirm identity with government-issued photo ID. Exam authority: the ME signs and dates determine start of certification period.
Third, Medical Expert Panels, MEPs. Purpose: provide best practice recommendations, not regulations. Deviations allowed only if documented and evidence-based.
Cardiovascular system post-MI, heart attack. Wait 2 months. EF greater than or equal to 40%. Tolerate meds. Greater than or equal to 6 METS. Cardiology clearance. Post-PCI, stent. Wait 1 week, 2007, or 3 weeks, 2013. Asymptomatic, cleared by cardiology. Post-CABG. Certify greater than or equal to 3 months post-surgery. EF greater than or equal to 40%. Asymptomatic, cleared. Recertification. Post-CABG. Stress test every 2 years after 5 years post-surgery. Heart failure. Disqualify if symptomatic or EF less than 40%. Annual recertification once stable and EF greater than 40%. Implantable cardioverter defibrillator, ICD, disqualifying. Pacemaker. Wait 3 months after implantation for neurocardiogenic syncope. AAA, abdominal aortic aneurysm, disqualify. Greater than 5.5 centimeters, men, or greater than 5.0 centimeters, women, or symptomatic, increasing greater than 1 centimeter per 6 months. After repair. Certify greater than or equal to 3 months post-surgery for 1 year. Primary certification factor, size and symptoms. Blood pressure standards. Less than 140/90, normal. 2 years. 140/159/90/99. Stage 1. 1 year. 160/179 out of 100/109. Stage 2. 2 to 3 months, then 1 year if less than 140/90. Greater than or equal to 180/110. Stage 3. Disqualify until controlled. After control. Certify for 6 months, then every 6 months.
Endocrine, diabetes, non-insulin treated. No FMCSA limit on A1C or glucose. Managed clinically. Insulin treated. Must have MCSA 5870 signed within 45 days. Provide 3 months of electronic glucose logs. Maximum certification, 1 year. Disqualify. Missing MCSA 5870. Recurrent hypoglycemia requiring assistance, or unstable diabetes. Neuropathy, potentially disqualifying if severe sensory loss. FMCSA focus, prevent hypoglycemia, not hyperglycemia.
Pulmonary/respiratory pneumothorax. Must show full radiographic resolution before qualifying. Greater than or equal to 2 spontaneous pneumothoraces on same side without surgical correction. Disqualify. Pulmonary function testing, PFT. Indications: lung disease, surgery, symptoms, SOB, cough, wheeze. Obtain ABG if O2 sat less than 92% or FEV1 less than 65%. Disqualify. PaO2 less than 65 millimeters of mercury, relested 5,000 feet, or PaCO2 less than 45 millimeters of mercury. Asthma COPD. FVC less than 60%. Disqualify. If O2 sat 90%, order ABG. Sleep apnea. CPAP compliance greater than or equal to 4 hours per night on greater than or equal to 70% of nights. Reassess yearly. Neurological epilepsy. Disqualify. Active, history, or on anti-seizure meds. Can certify only if seizure-free and off meds greater than or equal to 10 years. TIA. Wait 1 year, then certify if neurologically stable. Stroke. Assess residual deficits and seizure risk. Dementia. Alzheimer's, Lewy body. Disqualify. Reversible metabolic dementia. May certify once resolved. Febrile seizure, childhood. Eligible for certification. Abnormal findings. Positive Babinski. Neurology referral. Vision and hearing. Vision standard. Greater than or equal to 20/40 in each eye, corrected or uncorrected. Greater than or equal to 70 degrees horizontal field in each eye. Color recognition. Red, green, amber. Cannot use determination pending if fails vision test. Monocular drivers require MCSA 5871 within 45 days. Hearing standard. Whisper test greater than or equal to 5 feet in better ear, with or without aid. Or, average loss less than or equal to 40 decibels at 500, 1000, 2000 Hz. Fail equals disqualify. Refer for audiogram or FMCSA hearing exemption.
Hearing exemption, valid up to 2 years.
Mental health and substance use. Major depression. Post-suicide attempt or hospitalization. Wait 1 year symptom-free. Tricyclics, for example amitriptyline, disqualify or refer due to sedation risk. Marijuana, medical or recreational, disqualifying, Schedule 1 substance. Alcohol use. No current diagnosis of alcoholism. Refer to specialist if suspected. May requalify after treatment. Psychotic disorders. Disqualify. Unpredictable behavior. Musculoskeletal and physical function. Amputation, limb loss. Requires skill performance evaluation, SPE. May certify for up to 2 years. Carpal tunnel post-surgery. Test grip, prehension, sensation. If normal, certify 2 years. Range of motion, ankylosing spondylitis. Must have adequate motion to perform all CMV tasks. Laboratory/urinalysis. Urinalysis required. Check for protein, blood, glucose. If glycosuria, perform fingerstick or blood glucose test immediately. Common disqualifiers. Ejection fraction less than 40%. ICD or untreated arrhythmia. Active alcohol substance abuse. Uncontrolled hypertension greater than or equal to 180/110. Unresolved or recurrent pneumothorax. Narcolepsy. Uncontrolled diabetes or missing MCSA, 5870. Color vision failure. Cannot distinguish red, green, amber. Active psychosis or dementia. Use of Schedule 1 drugs, for example, marijuana, LSD.
Essential physical exam findings. General, overall appearance, obesity, distress, behavior. Cardiac, murmurs, abnormal S2, paradoxical split, investigate. Neuro, reflexes, sensation, coordination. Respiratory, breath sounds, chest expansion. Eyes, pupils reactive, vision fields, color recognition. Ears, whisper test or audiogram. Urine dipstick, protein, glucose, blood.
Key principles for MEs. Public safety greater than employment interests. When in doubt, refer to a specialist. Document everything. Only certify when condition is stable and well controlled. Use determination pending judiciously, never for failed standards. Certification periods must always be shorter for risk conditions, CVD, diabetes, sleep apnea.
Normal exam 2 years, fully qualified. Controlled hypertension 1 year. BP less than 140/90. Stage 2. HTN 3 months, then 1 year if improved. Stage 3. HTN disqualify. Until less than 140/90, post-MI, 1 year. After 2-month wait, post-CABG 1 year. Stress test every 2 years. Heart failure 1 year, EF, greater than 40%. Diabetes, insulin, 1 year. MCSA 5870 required. Sleep apnea, on CPAP, 1 year. Verify compliance. Vision or hearing waiver, 2 years. Must meet exemption criteria. Post-AAA repair 1 year. Greater than or equal to 3 months post-surgery.